is even remotely possible. With this, I welcome you to our admission ceremony, and really, it's a great, great honor for me to introduce to you our guest speaker for this evening, somebody that I've admired, who I've gotten to know very well, a dear friend, and somebody who, as an entire fraternity, actually needs no introduction, not just in our region, but certainly even globally. Our guest speaker for this evening is Dr. Matshidiso Rebecca Moeti. Dr. Moeti is the first woman to be elected the World Health Organization's Regional Director for Africa. She's a public health expert, she's a medical doctor, and prior to joining WHO in 1999, Dr. Moeti worked with the Joint United Nations Program on HIV and AIDS. Some of you may know it as UN-AIDS. And she was a team leader of the Africa Middle East Desk in Geneva. With the United Nations Children's Fund, some of you will know it as UNICEF. She was also the Regional Health Advisor for East Southern Africa in that capacity. And she also worked with the Botswana's Ministry of Health as a clinician and public health specialist. After joining WHO Africa's regional office, she served in that capacity as the Deputy Regional Director, Assistant Regional Director, Director of Non-Communicable Diseases, WHO representative for Malawi. She was also coordinator of the Inter-Country Support Team for the South and East African countries and regional advisor for HIV and AIDS before being elected to the top job of WHO on this continent. Dr. Moeti has a number of achievements. She has invested in areas such as surveillance, training, innovation, community engagement, and partnerships, which have improved countries' capacity to prepare for and respond to around 100 acute health emergencies that occur in the region annually. This resulted in faster, better, coordinated, and more effective response to outbreaks like Ebola. She has also led a robust response to the COVID-19 pandemic. I do want to say that hers is certainly the voice that was trusted during this very difficult time on our continent. Later on this evening, I do want to add that we will be honoring Dr. Moeti with the highest award that the CMSA can accord a person. And this is called the Honorary Fellowship of the Colleges of Medicine of South Africa. She will be, when we honor her later on this evening, only the second Black woman to achieve this award, the first being Dr. Mampele Rampele, and she will certainly, I must add for the people in the audience who are public health physicians, she will be the first public health expert. And Dr. Moeti joins previous recipients of this award like former Tata President Nelson Mandela, C.S. Barlow, Mr. Ishmael Katrada, Mr. Harry Oppenheimer, and many, many more distinguished luminaries of this award. I really cannot think of anyone more deserving. And so colleagues, without much further ado, I call on Dr. Matshidiso Moeti.
Dr. Flavia Senkubuge, President of the Senate of the South African Colleges of Medicine, Vice President Professor Johan Fagan, Platform Party, Professor Eric Buch, Chief Executive Officer, Deans of Faculties of Health Sciences, diplomats, fellows, certificants, and your families and friends, ladies and gentlemen. A very good evening to you all, and congratulations to all of tonight's diplomats, fellows, and certificates. I'm both deeply honored and humbled to be invited to address this prestigious admission ceremony, coming at a time when we are all well into the third year of the most challenging global pandemic of modern times, commitment to medicine and the health and welfare of populations we all see this through an altered lens. As COVID-19 case numbers decrease globally and public health and social measures are eased, we continue walking the very fine line between guarding against a resurgence while allowing ailing economies a chance to begin their recovery. Here in South Africa, President Cyril Ramaphosa ended the state of emergency just weeks ago, after 750 days, declaring that it's time to grow the economy and create jobs and get the country back on track. For all of you here tonight, however, battling the COVID-19 pandemic is an experience that will likely never be forgotten. In so-called normal circumstances, postgraduate specialization pushes you to the limits of your physical and mental capability. But the onset of the pandemic during your training has surely delivered some of the worst circumstances imaginable. What you've gained, however, are unique and invaluable skills and expertise that will surely ensure that you are better prepared for future challenges, both professional and, I dare say, personal. That's important because COVID-19 won't be the last health emergency we'll face in Africa or globally. And while the pandemic certainly has laid bare the fragility of our health systems, economies, and societies, here in South Africa, across the continent, and worldwide, it also provided a valuable opportunity to address some of the systemic health gaps. Primarily, COVID-19 highlighted the inextricable link between health and economic development in ways that will, going forward, I hope, make a difference in investment worldwide and here on the continent forever. Similarly, the pandemic highlighted the equally close link between health and other social and development sectors, with the poor bearing a disproportionate burden of the impacts wherever in the world they live. Our work as a medical profession is really about people. We have a responsibility, especially as scientists, to not only produce the brilliant tools that will improve health across the globe, but to clearly communicate the benefits of those tools to politicians, to communities, and to ordinary citizens. I'm sure we all recall the drama of the former US President Donald Trump, in one of the most stark examples of the challenge of making politicians understand science when, in 2020, he suggested that inserting disinfectant into the bodies of coronavirus patients might help to treat COVID-19. As scientists and as medical professionals qualifying today, we need to always remain connected to the impact of what we do, what we produce, and what we work on, how this is going to be deployed on the ground among ordinary people, regardless of our field of focus. In the African context, especially specifically, you have an important role to play in training and supervising other cadres to, in the meantime, while we invest in developing the highest level of technical cadres in our health systems, reduce the skills and delivery capacity gaps that could take decades to close in Zambia. I was so thrilled and fascinated while we were waiting to get into an argument with one of the leaders of the SIMSA on this. So clearly there is much to discuss and to sort out about whether we have a special system of health, low in quality for the poor and another for the rich. And I think that is very much central to my talk today. In Zambia, for example, what we call task shifting, due to doctor shortages, has seen trained non-physicians who deliver life-saving medical and surgical procedures become the real backbone of surgical services, equity and access in rural areas. About 4 months into the COVID-19 pandemic in 2020, a journalist asked me how I keep going against the daunting oncoming tide. I responded then that I was hugely optimistic and encouraged by the positives. 2 years later, I'm happy to be able to say that against the odds, including huge inequities that drastically delayed the rollout of our vaccine programs in Africa, for example, and continue today, we are weathering the storm with resilience and with determination. As medical specialists, there'll be countless times in the years ahead when I hope to take my advice to also tackle the challenges by looking for the positives. Working in the medical field in Africa is certainly not for the faint-hearted. With a very low, only one healthcare worker per every 1,000 people, less than half the set minimum standard, I must say, of 2.5 health workers per 1,000 population required to provide basic healthcare, and further skewed by the rural-urban imbalance. A regular 40-hour work week is routinely accompanied, for many of you, I'm certain, by long hours of overtime, probably unpaid. In South Africa, there are an average 16.5 specialists per 100,000 population against a comparative number of well over 250 for the OECD countries and 365 in the United States. So resilience, flexibility, adaptability, along with tenacity and deep commitment are all critical for us as health workers on this continent. This is something to which I'm certain you've all become accustomed. From a very young age, I learned this from the example of my own parents, if you forgive a few personal notes, who started their careers as young doctors running a general practice in a township in Springs, not very far from here. They went on to devote their lives to public health care and policy. My family left South Africa for Botswana when I was 11 years old to secure better educational prospects for myself and my siblings, and to escape, quite frankly, the hostile interactions with the apartheid police who believed that my father was hiding seditious literature under the bed. He believed very strongly, as do I, in the power of education to transform people's lives. He came from a very impoverished background and was lucky to get a scholarship to go to medical school. But he knew he had to act when the 1954 Bantu Education Act threatened to rob his children of the same education. In Botswana, in my migrant family, my mother helped to introduce family planning services, while my dad became, among other things, the smallpox commissioner for Southern Africa. So part of a global team working to eradicate smallpox, which became a reality in 1979. And I remember him going away for weeks on end into the bush to provide clinical services, to follow up on cases, to collect data in the rural areas in Botswana. However, while my parents, the situation in South Africa, and my school in Swaziland instilled in me an appreciation for social justice and education, my early plans certainly didn't include becoming a doctor. As a youngster in my teens, I wanted to chart my own path away from the family business. I decided I wouldn't study medicine. Then, when I ended up going to the University of London's Royal Free Hospital to pursue my medical degree in one way or the other, I said I wouldn't marry a doctor. As it turned out, I've done both. Public health was also not my first choice, despite it being the focus of many discussions around the dining table in my home as I was growing up. After starting my career as a doctor, I had a small child and wanted to continue my studies to be a pediatrician, in fact. But since there was no medical school in Botswana, I would have had to leave my child, who's actually here in the room with us today, for several years, and leave my family as well. That is an illustration of the obstacles that women face in their career paths, on which we also need to work collectively to do something. So that's the short story about how I became a specialist in public health. Each year that I've worked in this field, my appreciation of global health has grown. And today, as the World Health Organization's first woman regional director in Africa, with 40 years experience, including in the fields of HIV, TB, non-communicable diseases, Ebola, and now COVID-19, I'm still inspired by the great value of preventive and community-based interventions. During my early years working in tuberculosis wards, in my first job in Botswana in a district hospital, the most unpopular place to work was the TB ward. So as a newcomer, I was assigned to work in this ward. I experienced firsthand the link between health and the social condition. Childhood malnutrition, for example, I discovered when I worked in the pediatric ward, was driven by teenage motherhood and absent fathers. This was the real-life consequence of gender inequity, which was lethal for child health and for child malnutrition, as well as we know very well for HIV. So HIV was my first epidemic, and the lessons I learned afforded me a better understanding of global health inequity, which played out in this instance in a very different access to available treatment. As with your and our experience with COVID-19, I'm sure, I felt at that time helpless and furious, specifically regarding the lack of access to antiretrovirals, but more generally, around the challenges posed by economic, social, and cultural inequities driving, for example, the vulnerability of women and girls. At the same time, however, the solidarity between the Western and African affected communities, essentially gay men from the West and very many women in Africa, highlighted the power of partnerships and the power of civil society, which has also been critical during the COVID-19 pandemic. The same is true of WHO's 3x5 initiative, which aimed to provide antiretroviral treatment to people living with HIV and AIDS in developing and middle-income countries. This gave us lessons about adapting approaches to suit the circumstances and cover the gaps, like the Zambian task-shifting example that I shared earlier, which I believe are still relevant today as we work to invest better and minimize the inequities. So along with such task shifting, other lessons include the central role of primary healthcare in scaling up access, the imperatives of decentralized health services, the value of partnerships, and the need for more investments in health. And I'd like to say about primary healthcare, again, that it is not a poor people's solution. As we know, we can see that it's being reinvested in and re-emphasized in the richest countries in the world, and the COVID-19 has provided a very important lesson there. The start of my first term as Regional Director for Africa was massively challenging, with Ebola ravaging 3 West African countries and threatening the region and the rest of the world. But all these experiences meant that when COVID-19 arrived, I could meet it, I hope, with a unique set of experiences behind me, some skills, and some expertise. I'd now like to share with you some of the learnings that have proved important in dealing with the COVID-19 pandemic, as well as with public health more broadly. The first, as I've already said, is a critical link between health and politics. I often hear my colleagues say, I'm a technician, I'm not a politician. I don't dabble in politics. But we know that in order for the policies, the investments, and the actions to be appropriate and resultful in countries, we need to interface with the policymakers and the politicians. On a more optimistic note, if you compare the HIV story to that of COVID-19 in terms of political agency by African leaders, we have made great strides, I observe. There is definitely a different political dynamic happening now. What the African Union has been able to mobilize in response to COVID-19 is clear evidence of that. And it reminds me of the first Abuja conference on HIV/AIDS, which I attended from WHO, having spent half a year supporting the then Organization of African Unity in preparation. My recollection is that as soon as it was announced by Kofi Annan that we are working on establishing a global fund to support countries to respond, the speeches from political leaders became all about, we need money We need to be funded. We are waiting for the fund. I recall leaving the conference hall in exhaustion and despair and going to my room in the hotel, because what I had been expecting to hear was strong statements of determination to act, to invest even within limited resources by African leaders to save the lives of millions of African people who died of HIV and AIDS. And I do believe that what we have seen happen in the last 2 years in the African Union has been very different from this. So there is hope on the political front. Next, we need to have resilient public health systems in place throughout countries, including in the most remote parts. In practice, this means health systems that are properly equipped with staff that are trained and resources to continue delivering uninterrupted essential health services, even as they quickly detect and respond to health threats and emergencies. This capacity to identify and monitor risk is crucial for the early detection of the start of any outbreak. Ebola, for example, started in a remote area of Guinea, and so was able to spread quickly and quietly, unnoticed, among vulnerable communities. Good primary healthcare systems are also crucial for early detection of chronic non-communicable diseases, which frankly are the next pandemic, which is already with us. Screening for hypertension and diabetes, for some cancers, can significantly reduce deaths due to cardiovascular diseases, to renal failure, which kill Africans at much younger ages than people in other regions. At the same time, we must be able to switch on and quickly scale up health systems in an emergency. Investments to close and fill identified systemic gaps is needed before a pandemic hits. And we have observed in Africa, as in other regions, but most severely in Africa, how the start of the pandemic, the lockdowns, the fear of getting infected at health facilities, and having healthcare workers be assigned to work on the pandemic caused huge drops in the coverage of some very essential public health measures: child vaccination, access to family planning, women delivering safely in hospitals and health centers. They all dropped, and these are gaps we now need to cover as we recover from the COVID-19 pandemic. So investing in health systems in a consistent way in what is called peacetime would reduce the necessity to pour in money when an emergency happens, and the capacity to respond would already somewhat be in place. I'm sure we'll be counting the billions that are being spent today to respond to COVID-19, even in cases where consistent, adequate investment in public health systems, and I dare say in clinical systems, could have prevented some of the catastrophes that we saw in some countries. I'd like to now refer to the importance of the private sector's role, which was certainly highlighted during the height of the HIV epidemic, and now very much with COVID-19, to complement the public sector and to grow an overall health response. These partnerships will be critical going forward. For example, we've seen in respect of manufacturing of vaccines and other tools in Africa, and will be key as South Africa advances, for example, towards national health insurance. Technology, as an enabler during COVID-19, also gave us important lessons in its huge potential to cover gaps and accelerate solutions. It has, for instance, been a powerful tool to connect healthcare workers in remote areas with expert clinicians in towns and cities, allowing for optimal treatment of patients on site and minimizing sometimes the need to transfer people. So turning now to the important issue of interconnection between diseases, Ebola illustrated the wider impact on improving people's health. When people were able to wash their hands more and practice better hygiene, we were able to control Ebola, but we also saw concurrent reductions in diseases such as cholera, for example. This emphasizes the need to recognize the links between such diseases, including starting to overcome the barriers between communicable and non-communicable diseases. If we look at the way in which many health ministries are structured on our continent today, they are very much divided up in programs that, in fact, make it difficult to make the connections and to use the resources that are available, the scarce resources, more efficiently to have results. This link between non-communicable and communicable diseases has been dramatically illustrated by COVID-19 and the underlying conditions, hypertension, diabetes, for example, that increase vulnerability to severe disease and death. It's also evident clearly in the connections between hepatitis and liver cancer, the human papillovirus, and cervical cancer. From an investment perspective, this suggests that much greater impact could be achieved with targeted funding for specific key areas as opposed to the sometimes fragmented investment that remains common on our continent. A new approach of this nature would need to be incorporated into policy and action by governments, by donors, and other partners, reflecting the view that human health and well-being are materially interlinked with sustainable development. Many risks to health are influenced or even determined by policies in sectors other than health. Transitions in energy and transport, for example, have multiple health co-benefits for environmental protection. Another key sector responsible for policies that offer win-win situations for health includes safe drinking water, which really should be regarded as a human right, and sanitation and hygiene. Overall, there remains an urgent need to be more effective in translating resources into good health care for the poor, as well as for those that are better off. In the Southern African context, and in countries like the United States and the United Kingdom, given our history, these are overwhelmingly Black people. In South Africa, the challenges to equity and solidarity are something of a microcosm of what we've experienced in the inequitable global response to COVID-19. This saw richer countries stockpiling vaccines in the early stages of the pandemic, effectively cutting off access to multinational platforms like the COVAX facility and the African Union's AVAT. In effect, this meant African countries could not immediately protect their citizens from infection. Happily, this situation is changing now, and we are put in the position of catching up with the rest of the world. A recent article highlighting the relationship between the COVID-19 pandemic and inequality in South Africa, published by Wits University, highlights the severe domestic inequality between the private and public hospital systems. With 80% of the population having no medical insurance and the other insured 20% accounting for half of all healthcare spending, lack of access to healthcare is driven by income inequality. Research by the Discovery Foundation in 2019 showed that in South Africa, there are only 7 specialists per 100,000 population in the public sector against 69, almost 10 times as many, per 100,000 in the private sector. So addressing inequality in health in this country has been a long-standing effort we've observed. When I delivered virtually the second Bongani Mayosi Memorial Lecture at the University of Cape Town earlier this year, I stressed that Africa needs scientists, medical professionals, nurses, care workers, institutions, and infrastructure capable of delivering African solutions to African healthcare challenges. WHO in Africa aligns firmly with the late Professor Mayosi's belief that there is a need to grow our own timber. This philosophy emphasizes excellence while nurturing and mentoring people with potential, especially women, I might add, in order to create a pipeline of future African doctors, scientists, and researchers that will produce the solutions for this continent. So all of you today are part of that pipeline, and that gives me confidence that we will indeed be able to achieve universal health coverage for our continent. Surgery, for example, has an essential role to play here, cutting across all aspects of health. It has the capacity to save millions of lives every year while allowing many more millions to live free from disability and chronic disease. The economic impact of surgical inequity also makes surgical services essential in achieving universal health coverage. So we move away from that idea that primary health care and public health is only about things like vaccination. So essential services acquired early by populations will also make a huge difference. Surgery has the capacity to save millions of lives every year, allowing people to live free from disability in the future. The economic impact of surgical inequity also makes surgical services essential in achieving universal health coverage. As I've said before, millions of people in Africa face catastrophic financial expenditure while seeking access to surgery, many traveling, at least from sub-Saharan Africa, I'm aware, to India and to some of the North African countries, and of course, many coming here to South Africa to access such services. So it's an essential service that's needed to be developed throughout the continent. And sometimes forced to choose between their health and their financial security, many people forego treatment rather than face financial ruin. The choice is as stark as that. The challenges are indeed daunting, but I hope that, like me, you will find inspiration in many unexpected places, especially among your hardworking colleagues who continue enthusiastically despite the huge challenges. It's truly humbling to witness the many sacrifices made by health workers in the interests of the greater good on our continent. So going forward in your careers, I urge you to maintain your relationships with those who are your biggest supporters. For me, this has been a fail-safe confidence builder that began with my parents, who were incredible role models. Today, it's my husband, my children, my siblings, my family, my friends, and my colleagues, and I'm very happy that some of them were able to join us here today. Make sure to stay in touch with family and loved ones, and when you can, also support and mentor your friends and younger colleagues. Make sure to be connected with your friends. Their support will be a lifeline. So congratulations once again to each and every one of you, and thank you to the South African Colleges of Medicine for this huge honor. Thank you very much.
Thank you very much, Dr. Moite. Can we please give her another round of applause? Dr. Moite, your speech was not only inspiring, but I thank you for sharing a piece of your story as well, because I think there are many people in the audience who may see you reaching these great heights and not know the journey. So, as I said, it is important, not only just for our graduates, but I know some family members and their children are also here. For instance, this evening, I have my special guest, my goddaughter, Busanele, who I'm sure is truly inspired by your speech as well. And so, ladies and gentlemen, I really now want to proceed with the admission of Honorary Fellowships, and this will be followed by the presentation of medals to distinguished candidates and the admission of new diplomates, fellows, and certificates by examination. Prof. Nalone.
Madam President, election to the Honorary Fellowship is the highest honor the College of Medicine of South Africa can bestow. Such honor may be bestowed to recognize achievement of the highest order in the fields of endeavor within the ambit of and contributory to the objectives of the Colleges of Medicine of South Africa. To honor through the persons of a senior office bearer, a foreign sister college or equivalent institution with which the College of Medicine has a mutually beneficial association. to recognize achievements of the highest order in their fields of endeavor by persons in South Africa or globally. Madam President, it therefore gives me great honor to call upon Professor Johan Fagan to present Dr. Matsidi Somweti for admission to Honorary Fellowship of the Colleges of Medicine of South Africa.
Madam President, it's my singular honor to present to you Dr. Matshidiso Rebecca Natalie Moeti. Dr. Moeti is the first woman to be elected as the World Health Organization's Regional Director for Africa, and she has devoted most of her life to battling poverty and inequality, striving to realize her vision of securing health and well-being for all Africa's people, regardless of age, socioeconomic status, or geographic location. A medical doctor and public health expert with more than 40 years of national and international experience, Dr. Moeti admits to having little early interest in medicine, despite growing up with two parents who were devoted to healthcare and policy. That all changed, however, and this powerhouse advocate for universal healthcare obtained her Bachelor of Medicine and Bachelor of Surgery from the Royal Free Hospital School of Medicine of the University of London in 1978, and then a Master of Science in Community Health for Developing Countries from the London School of Hygiene and Tropical Medicine in 1986. Now, among all the long list of key achievements, Dr. Moeti is renowned for having led the WHO's 3x5 initiative in Africa at the height of the HIV/AIDS epidemic, changing the face of access to antiretroviral therapy among people living with HIV. By empowering nurses to prescribe ARVs, her work helped to shift HIV from a death sentence to a chronic illness in Africa. In leading the WHO's work in Africa since 2015, tremendous progress has been made. The wild polio virus was kicked out of Africa in 2020, the second disease to be eradicated from the region after smallpox 40 years ago. Dr. Moeti has also driven a groundbreaking transformation agenda to make the organization more effective and results-driven and accountable. It's being successfully implemented, producing numerous innovations that have improved the pragmatic and the management performance of the WHO in the African region. And this agenda has also been recognized by the United Nations Joint Inspection Unit, among others, for best practices recommended for other UN agencies to consider adopting. Other key achievements include overseeing the development and the adoption and the implementation of a strategy to mitigate the impact of climate change on health and making significant progress towards universal health coverage through primary health care. These efforts saw the Universal Health Coverage Index of country progress increase in the African region from 46 in 2017 to 48 in 2019. And this is compared to a global average of 66, both in 2017 and 2019. Dr. Moeti is also a great champion for women in leadership in global health, and has launched a partnership with the UN Volunteers Program to recruit 100 young women from the Global South as the next generation of health leaders. Under her leadership, the WHO in Africa has additionally rolled out several interventions to improve leadership skills, to build confidence, and to empower women to go after roles that reflect their capacity. In recognition of her excellent service to humanity, Dr. Moeti has received accolades including an Honorary Fellowship from the London School of Hygiene and Tropical Medicine, an honorary Doctorate of Science from the University of Health and Allied Sciences in Ghana, and honoris causa, a doctorate by the Instituto de Higiene y Medicina Tropical Universidade Nova de Lisboa. That was a mouthful. Yeah, and was named a COVID-19 heroine by the Ellen Johnson Sirleaf President's Center for Women, and among the women of 2020 by the Financial Times. Most recently, she was honored with the membership of the United States National Academy of Medicine and special recognition for African health leadership on COVID-19 from AMREF Health Africa, and received a Global Health Equity Award from the America Institute. For her sustained, outstanding, and life-changing contribution to the health of the people of Africa, it is with great pleasure that I present Dr. Matshidiso Moeti for admission as an Honorary Fellow of the Colleges of Medicine of South Africa.
So, Dr. Moeti, by the power vested in me as the President of the Colleges of Medicine, together with our Senate, it is my singular honor and absolute joy to admit you to the highest honor of the Colleges of Medicine of South Africa. Thank you. I'm holding this gown because I want to be naughty and break with tradition, and I'm sure my colleagues won't mind. As Dr. Moeti said, we don't stand here alone. We have families, we have friends, and in the spirit of representation, I want to call upon Dr. Moeti's daughter, Rufilo, to help me to robe them on. We're still not done yet. I have to put this on you. Thanks, Rufilo. Because we're not allowed to shake hands. And then on behalf of the Colleges of Medicine, this is the honor roll that we present to you as our newest member of our highest award. We're still not done yet. It's a very high honor, Dr. Moeti. You still have to sign the book. So in signing the book, you join the previous luminaries, as I have said.
I'm sure we're going to sanitize after this.
We're nearly done. I'm going to call our Vice President, Professor Fagan, to present to you a gift. So, ladies and gentlemen, I really want to ask you once again to give a huge round of applause to Dr. Morgan. And I must add, Dr. Moeti, that in the spirit of particularly ensuring that women are represented, we have many allies on the stage, like my dean, Professor Diache, whose whole top management is actually women.
Madam President, it's my honor to announce the medals that will be presented to candidates that excelled and achieved outstanding results in the following examinations. Fellowship of the College of Otorhinolaryngology of South Africa, final, W.A. McIntosh Medal is presented to Shital Mungul for the May 2021 examinations. Fellowship of the College of Pathologists of South Africa, Anatomical Pathology Part 2, Dhiren Govender Medal to Dr. Mark Andrew Robson Cater for the October 2021 examination. Fellowship of the College of Psychiatrists of South Africa, Part 2, the Novartis Medal, presented to Dr. Megan Schultz for the May 2020 examination. Madam President, I present the following successful candidates for admission to the Diploma in Child Health of the College of Pediatricians of South Africa. Nadira Ali. Gugu Nokutula Dlomo. Ashlyn Job. Amahle Jongile. Collins Mueletsi Kekana. Lehlogonolo M. Peladi Khanyago. Nyakallo Kwadi. Diploma in Child Health of South Africa, Zamavezi Sinenhlanhla Kweyama. Ntwetsi Caritas Palesa Lerotodi. Shamaine Machimana. Tatenda Lois Mafana. Cebile Mahlalela. Nelly Precious Mahlalela. Sibongiseni Tikeza Maletsema Mashinini. Tsepo Matsane. Alilali Michelle Matsila. Tandile Prudence Makayake. Kulani Maimele. Tsakisani Innocentia Mboweni. Kundani Messi Mukhali. Buitumelo Musakwa. Nomsa Edith Mutiba. Leanne Naker. Media Naidu. Larina Narensami. Mukuvele Elewani Nemuramba. Nhlakanipho Ndumiso Nqamu. Yvonne Samkelisiwe Ngobese. Nedima Ruth Ijioma Nkado. Ongezwa Alutre Nkai. Buitumelo Emma Nkosi. Londiwe Proda Nkuna. Murongwa Ntabiseng Ramalatswa. Mama Bitsela Katlego Petunia Seabela. Nokukhanya Felicia Shakwana. Mihloti Cornelia Shipalana. Sherry Pelisa Silent. Abiola Ayobambo Soni. Byron Huroweth Ter Moshuizen. Mampolo Queen Tladi. Kelly Williams. Ziningi Nozipho Letukuthula Zulu. Madam President, successful candidates to the College of Family Physicians, Diploma in HIV Management of South Africa, Siyamthanda Zondi. Madam President, successful candidate to the Diploma in Internal Medicine of South Africa, Funeka Nyangani. Mohamed Olatundoboson Ogunglola. Muoko Rosemary Masilo. Havi Katleho Matsani. Priyanka Naidu. Avusiwe Pefile. Nomthandazo Sizakele Tiana. Madam President, I present successful candidates to the admission of the College of Anesthetists of South Africa, Edna Miller. Sibulele Cezula. Judith Kamala Joseph. Madam President, successful candidates for admission to the College of Otorhinolaryngologists of South Africa, William A. McIntosh Medal, Shital Mungui, May 2021. Dalitso Mwale. Jacobus Benjamin Opperman. Tato Pakwani. Madam President, I present successful candidates for admission to the Fellowship of the College of Pediatricians of South Africa. Minaz Abu. Faiza Doji. Reshoketswe Mankate Dijo. Catherine Fleck. Tijal Gokar. Tuduetso Khomo Ngube. Nicole Shireen Gordon. Donnie May Greiling. Abigail Hlambelo. Bukeira Christine Isila. Zizipho Agnes Jubase. Buinelo Mankube Katsi. Kulani Mabasa. Nokukhanya Mapalenhle Mabaso. Itumeleng Princess Mainecha. Raisa Musa Kara Mohammed. Tshidisegang Stefina Makalla. Lista Dipolelo Makamato. Ntombikayise Gladys Makoba. Jabu Marais Mapaki. Sizakele Fortunate Maphumulo. Sindiswa Maseko. Bujosi Masheto. Lerato Matela. Angidi Pillay Muri. Mina Ntodi Mavunda. Tsepang Mokoto. Mahlatse Virginia Mushabela. Lebogang Nozandla Doris Musidi. Nomsa Edith Mutiba. Onika Matsela Mutlatledi. Vusani Mudau. Lorraine Hlekani Mukiti. Nisha Naga. Aswathi Nandakumar. Bathabile Pearl Nkosi. Temitope Olawale Oluwandare Odubunimi. Tsireletso Ramapani. Livuani Rambao. Shital Ramsundar. Sandra Nakaiza Namuga Sebitosi van Jaarsveld. Ntabiseng Winsam Sali Sirudu Nageng. Yeah, that's tripping people. Kabelo Jeffrey Shokani. Aubakwe Betty Siamisa. Noneba Amelia Tambe. Jithin George Thomas. Jean-Paul Moulang Tsipeng. Tracy Lauren Tenner. Vusumuzi Valentine Zulu. Wait. Madam President, I present successful candidates for admission to the Fellowship of the College of Pediatric Surgeons of South Africa. Notolo Ziketelo Mashavavi. Tozama Violet Siotula. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Anatomical Pathology. Adam Rory Buatha. Mark Andrew Robson Cater. Florence Likubani Masha. Nosipho Maria Ntsangani. Patricia Pamacheche. Tsikani Norman Rikotso. Michael John Savage Reed. Anele Nomzamo Sokulu Cele. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Chemical Pathology. Chemedzai Esnath Chikomba. Reinhard Hesse. Doreen Rachel Jacob. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Clinical Pathology. Sunet Buertha. Makgabo Helen Hlongwane. Trisha Moodley. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Hematology. Tirosha Chetty. Michelle Human. Shani Rivka Levy. Ntsakisi Innocent Masingi. Miriam Manti Musi. Lina Siwanywa. Deborah Christina da Silva Mura Vaz van der Riet. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Microbiology. Annelle Bosch. Sinenhlanhla Nzabanzaba. Becky Zethi Masango. Selina Aida Mulaudzi. Mbongiseni Cypriel Nkambule. Mutumi Yuna Nteta. Roxane Elizabeth Rule. Sunila Savage Reed. Wait. Madam President, I present successful candidates for admission to the Fellowship of the College of Pathologists of South Africa, Virology. Rankotsani Bonolo Mashishi. Kwala Botseng Aniki Muhlala. Mukupi Brian Hector Muloi. Candice Tatum Betch. Madam President, I present successful candidates for admission to the College of Physicians of South Africa, Jiawu Chen. Lior Chenik. Denishan Govenda. Romana Yassat. Muabila Roger Kalonda. Rebecca Mahlaku Mahlaji. Barbara Makumbi. Pelelani Howard Malishi. Sibulele Mazwi. Palesa Poshia Mentoro. Lona Mahlaba. Karabo Kinsley Musidi. Chimangazo Mukiti. Stacey Nosworthy. Patience Ntakwazi Ntila. Emmanuel Ikochuku Okoli. Amira Parak. Zamangwe Londiwe Ramachach. Ahmed Mahomet Randeri. Lerato Matsie Setlalentwa. Sharon Elizabeth Suni. Sikanamisha Maveline Tema. Kagisho Thomas. Adrian John van den Berg. Madam President, I present successful candidates for admission to the Fellowship of the College of Plastic Surgeons of South Africa. Adam Ashor Mohammed Abed Al-Nabi. Notabo Makhofa. Nombulelo Patricia Metuse. Madam President, I present successful candidates for admission to the Fellowship of the College of Psychiatrists of South Africa. Lizelle Aldrich. Annette Antwi Anyimadu. Hendrik Stefan Bosman. Jade Catherine Bauer. Sikelo Owen Lulu. Lerato Khalisitwe. Ladawa Yasese Goga. Bianca Hart. Jabulani Johannes Jeme. Tato Lekati Mutsitle Kalani. Kabo Letsedi. Stacy Lee Lintar. Lidnar. Mpo Dorcas Mashwene. Jones Muriti Mwenda. Tembani Advocate Ngwenya. Vuyani Wiseman Ngumalo. Stacy Lee Ochse. Botu Pilediwa Pito. Shonisani Rapalalani. Megan Schultz. Thabo Patrick Tlolani. Zukiswa Tsolekile Divet. Sibulele Zuma. Madam President, I present successful candidates for admission to the Fellowship of the College of Public Health of Medicine of South Africa. Mohlamme John Matabate. Madam President, successful candidates for admission to the Fellowship of the College of Public Health Medicine of South Africa, Occupational Medicine, Asanda Matolweni. Edith Mara Juana Afonso Raja. Madam President, I present successful candidates for admission to the Fellowship of the College of Diagnostic Radiologists of South Africa. Rabia Abid. Tyrone Kwabena Nyanchaki Anor. Takalani Masala Bendlela. Ntabiseng Anki Chane Moja. Nicholas Christopher Christofides. Akingboye Musibau Dauda. Shabina Dawadi. Boitumelo Khoza. Sabelo Herbert Mabaso. Mpho Irene Maboho. Busisiwe Venus Makubela. Denny Matthew. Komutso Benedicta Mudiba. Besley Hunadi Mujapilo. Gary Charles Weston Paiza. Daniel Nicholas Prince. Sikosonke Asavela Tsobo. Lane Allison Walters. Ilonka Wanik. Madam President, I present successful candidates for admission to the Fellowship of the College of Radiation Oncologists of South Africa. Catelia Cassandra dos Santos Gaspar. Sithenjiswa Xolukehle Perpetua Mhlongo. Nonkululeko Zamaqimba Mlaba. Joseph Mtungameri Mtombeni. Ngumisa Ndamase. Masana Ndleve. Udirile Ubuseng. Cynthia Tsiying Chuang. Luvuyo Jasi. This is a successful candidate for admission to the College of Surgeons of South Africa. Avishkar Gurnand. Siabulela Hope Jada. Mark Mwenda Lubo Kashasha. Amuset Tekhanang Machete. Nicola Ami Macrobert. Athena George Maliakal. Helgard Michael Marais. Ludo Lurato Carol Masoli. Unkabetsi Fana Mulelekwa. Lirumo Evans Mutla. Paying Fio Mint. Tegesha Naidu. Mulefe Stephen Nchabeleng. Pumuzo Ndwambi. Megan Leslie Peffer. Katharina Pothas. Kimisha Sen. Anika Volmarans. Madam President, I present successful candidates for admission to the Fellowship of the College of Urologists of South Africa. Daniel Kwame Hector. Ramushweu Maxine Mazui. Kabu Simon Muloto. Sydney Mankale Murwatse. Nkateko Mtsetweni. Winston Parayachi. Ruben Charles Russ. Mansu Calvin Tusaho. Madam President, I now present successful candidates for admission to certificates in the following categories. These are specialists who are now super specialists. These are now experts. Certificate in Cardiology of South Africa, Pediatrics, Evans Mulendele. Poppy Rapul. Certificate in Cardiology of the College of Physicians of South Africa, Nompumelelo Gogo. Certificate in Critical Care of the College of Pediatricians of South Africa, Palesa Mabatu Munyaki. Certificate Critical Care of South Africa Pediatrics, Marlies Reinders. Certificate in Endocrinology and Metabolism of the College of Physicians of South Africa, Zodwa Nwabisa Dire. Certificate in Gastroenterology of the College of Surgeons of South Africa, Nadir Hilal. Certificate in Gastroenterology of South African Surgery, Joyce Nomsa Nkosi. Certificate in Medical Oncology of South Africa Pediatrics, Tandeka Vuyiswa Zamasundu Ngana. Certificate in Neonatology, Tsiamo Paul Muisa Mukhajan. Certificate in Neonatology of South Africa, Claude Christelle Eleanor Ondokongo Ezet. Certificate in Nephrology of the College of Pediatricians of South Africa, Nonhlanhla Lynette Zigalala. Certificate in Nephrology, Physicians, Lidile, Matsweni, Mokoka, Nkobo. Certificate in Nephrology, Physicians, Siviwe Ndamase. Subspecialty Certificate in Neuropsychiatry of the College of Psychiatrists of South Africa, Karishma Lawton. Certificate in Pediatric Neurology, Pindile Zandile Nteshana. Certificate in Pulmonology, Pediatrics, Alicia Lazarus. Certificate in Pulmonology, Pediatrics, Mutanga Kapamgele Mapani. Certificate in Pulmonology, Pediatrics, Refulo Keketso Mupedi. Certificate in Rheumatology, Physicians, Prisha Govender. Certificate in Rheumatology, Physicians, Makotso Mohapi. Certificate in Vascular Surgery, Lechaye Khomolemo Mokhasi.
Can I please ask that we give another huge round of applause to all our graduates? In closing this admission ceremony, I want to say exactly what I said yesterday, that on behalf of the CMSA, to all our graduates today, you are now officially part of a select few that have the privilege of being called medical specialists. With that in mind, I want to remind you never to forget that even with this great achievement, you must remain humble, you must remain grounded. In your hands, you've been entrusted with the lives of people who are very precious to someone. These people that we call patients, they are mothers, they are daughters, their sisters, their fathers, their grandfathers, their brothers. Treat them with love. My hope for you is that you can clap, absolutely. My hope for you is that you will be guided by humility first. Please continue to read. You heard Dr. Moeti's speech and her journey. Continue to search for answers, to grow, to broaden your minds. Remain in our beautiful country. Remain humble. Always remember the people who have supported you in your journey. Never, ever lose your humanity. Many of you will go to graduation parties this evening and celebrations to mark this momentous occasion, and you will hear numerous speeches and be given a great deal of advice today. But I do want to give you my humble piece of advice. In everything you do in your career, remember that it is geared towards taking care of others. But while you're taking care of others, remember to take care of yourself. Remember to rest. Remember to recuperate. Don't feel ashamed. When you need to take time off to look after your physical and mental well-being, do take it. Be extremely, extremely kind to yourself. Be kind to others. Be gentle with yourself, because there is only one you. I say it at all the admission ceremonies, and I really mean it. Remember that you matter. You are precious. You count. Your voice matters, and it's very much needed. I want to thank the entire CMSA family and staff, and especially this evening, I want to thank Dr. Moeti for traveling all the way from Congo, Brazzaville, to be here with us this evening. I want us to please give another round of applause to Dr. Moeti. And in my closure, I want to again thank our families who are just so precious. I know tonight is especially very special for me because I have my entire family with me this evening. And I want to thank you all, our family members. You hold us at the most critical and difficult times, and sometimes we may not say thank you, but today, on behalf of our graduates and everybody else on the stage, I want to again say thank you, thank you, thank you. I wish all our graduates the best in your journey forwards, and I leave you with the words of one of my favorite poets, Walt Whitman, who said, "Keep your face always towards the sunshine, and the shadows will always fall behind you." And so, ladies and gentlemen, I want to ask you all now to please stand for the National Anthem. so, ladies and gentlemen, as I said, my entire family, my chosen one, and my extended family, I do want to say to the graduates something special, again in breaking with tradition, that when I was in first year, when I was only 19 years, a very dear brother of mine called Terence Ngosi said to me, "You're going to be closing admission ceremonies one day." And he's here this evening, so this is for Terence. By the power vested in me and on behalf of the Senate, I now dissolve the proceedings of the CMSA.
Obstacles